Thank you, Dr. Fisk. Fascinating information on MS and the other comorbidities, which leads us directly into taking care of ourselves. And we have with us Karen Gibson, who is a nutritionist and a dietitian, and she is going to talk to us about one of the ways that we can take better care of ourselves. So please welcome Ms. Gibson.
Thank you. Well, it was really nice for me to see that the first thing Dr. Fisk had on a list of things you can do to take control and take care of yourself was to eat well. So we didn't plan that. It just turned out to be perfect. I'm really excited to be here this evening and to be asked to speak to you about the role of nutrition and multiple sclerosis. It's been a big part of my job for many, many years, pretty well all 23 of them. I was one of those people who was lucky enough to find their dream job the first time I got a job. And I've been working at the Nova Scotia Rehab Centre for just about as long as I've been a dietitian. I've had the privilege to work with patients with MS and their family members as both inpatients and as outpatients who attend the MS clinic at the rehab. And I work alongside a wonderful team that's headed by Dr. Christine Short. Some of you look familiar, and I think if you've not met Dr. Short, you've probably heard about her. She's a pretty passionate lady who's working really, really hard to help everybody in Nova Scotia who has MS. So it's been a privilege for me to work alongside her and get to know so many wonderful people. The presentation of information I'm going to share with you this evening is a combination of things that I've gained through my experience and evidence-based guidelines that are presently in the literature. First of all, we all know that Canada's Food Guide it's long been recognized as the best advice that healthcare professionals have when it comes to describing what healthy eating is. I'm sure there's not anybody here who hasn't got a copy of Canada's Food Guide on their fridge or had it brought home from somebody in school. What's neat about Canada's Food Guide now is if you can get on the site that I've quoted there, you can go on and actually make your own food guide. One of the problems with Canada's Food Guide is it tries to meet the needs of everybody on one piece of paper. So you get these huge ranges. You should eat between 5 and 15 grains and 4 and 17 fruits and vegetables. I'm exaggerating. But if you go onto this site and click on My Food Guide, you can actually create a plan that takes into consideration your age and your sex and your physical activities. And within 7 minutes, you can make your absolute own individualized food guide, which takes a lot of the guesswork out of what we used to always encourage people to find where they fit on that big range, and now the computer will do it for you itself, and you end up with your individual plan. What I want to focus on today is the benefits of healthy eating to individuals specifically with MS. So as well as your general health and reducing the chance or managing those other comorbidities that Dr. Fisk has mentioned, the diabetes, the heart disease, the blood pressure, all the things that he brought up that come along with aging. Healthy eating helps with all of those things, but it also has some specific benefits that are of interest to individuals with MS. The ones I wanted to discuss this evening are how nutrition can help improve fatigue, help optimize weight, help with bowel and bladder management, bone health, and skin integrity. So we're just going to work through each of those. So many of my patients have told me that fatigue is something that really impacts their quality of life. There are so many things they want to do that they're not able to do because they're too tired. From a nutrition point of view, fatigue can have a huge impact on what you're eating. People tell me they're too tired to plan, they're too tired to shop, too tired to cook, and finally too tired to eat. Oftentimes people will say, by the time I've done all that, I'm no longer interested in eating it. Other times people will say, it's just too much work to eat. It's too much work to chew and swallow, and I can't be bothered. So what we end up with is a vicious cycle. People aren't eating and making healthy meals, and they're not eating because they're too tired, which feeds into the fact that they're fatigued. So we end up with this vicious cycle. What I encourage people to do is to try and take the hard part of eating healthy and make it simple. Oftentimes we'll start with something as simple as, let's make, instead of a meal when you're tired and worn out, a meal can now be a slice of whole wheat toast, some peanut butter, a few pieces of a banana, and a glass of milk. That's a perfect, healthy, balanced, easy meal. So you end up feeling good about what you've eaten, because by now you're all sold on the reasons why you have to eat healthy. But you don't want to feel bad that you can't eat healthy because you're too tired to make it happen. So let's make it simple. Some of the suggestions that I found in the literature and that I use in the clinic are try not to go longer than 4 hours without eating. You end up getting hungry, you end up getting tired, and it just becomes too big a deal to get through the next meal. So keep it small. Divide up your sandwich. Have a little bit with a piece of fruit and a yogurt at noon, and maybe at 3 o'clock, have the other half, so that you're not getting to the end of the day tired, hungry, and feeling overwhelmed. Snacks, throughout the day, I encourage people to include protein in their snacks. So if you're going to have a cookie, grab a piece of cheese or a yogurt to go along with it. It just helps to sustain you longer, rather than giving you a burst of energy and then having it disappear. People often tell us that eating big helpings makes them feel tired, and I think we all know that on Christmas Day and Easter and Thanksgiving, how we all feel so tired after that big meal. So don't do it. Divide it up. Have a little bit now, have a little bit later. Other people find they get really tired after having something really sweet, and that makes sense. We get lots of sugar from it, and then that goes away. And that goes back to the reason why I'm asking you to have protein with a snack, to help keep your energy up a little bit longer. Now, the last one is a little surprising. I'm suggesting that you limit your caffeine intake. Many of us treat fatigue with coffee, tea, pop. Nowadays, it's Red Bull and other magic drinks that give us a short amount of energy but doesn't last as long as we need it. The problem with having too much caffeine during the day is that it then can affect your sleep at night. So you don't get a good night's sleep. You get up with being tired as well as having the fatigue from the MS, and it's just the vicious cycle continues. So I'm hoping that these tips and keeping it simple will help you break that vicious cycle and set yourself up physically to have as much energy as you can, so that you're taking what control you can and fighting that fatigue. Oh, sorry. Thank you. One of the biggest challenges that my patients with MS face is weight, and it ranges from being overweight to being underweight. It's the whole spectrum. We see all kinds of things. A study in the 1980s in the United Kingdom found that among individuals who have had MS for 10 to 13 years, 40% of the women and 44% of the men were overweight. It is something that we often see, that patients and family members, as well as the clinicians, we can attribute the weight gain to a reduction in physical activity. We can attribute it to some medications. Sometimes steroids are used to treat MS, and that can affect appetite and intake. And the same is true for antidepressants. Something that I've learned by talking to my patients and their families is that oftentimes family members and support people show a person that they love them with food. They make them all their best things, they bring them food every chance they get, and they take pleasure in watching their friend eat. So I've had patients tell me, I didn't want it, but she went to all that work to make it, and I ate it because it made her happy. So there's lots of reasons why people can struggle with their weight. Some of the tips that I've got for you to think about to help you avoid weight gain or to achieve weight loss, depending on where you are. Include not skipping meals. This is so common amongst people with MS and the general population. Lots of us are skipping meals. Breakfast is the big one that people skip. Try limiting your calorie-containing fluids. We've become a population that drink a ton of calories. You look at all those specialty drinks that they're selling at the coffee places, the mocha lattes and the tall blondes and all kinds of things. I don't know what's in them, but I know there's lots of calories and lots of caffeine. We're also drinking pop. We're drinking juice. We're drinking many, many calories. And those calories don't always make us feel full, but they certainly add up at the end of the day. Try limiting empty calories, and we all know what those are, the things that taste great but don't do anything good for us except provide calories. There's lots and lots of low-fat products in the market. Anytime you have a choice between a regular and a low-fat product, if you're worried about your weight, the low-fat product is the answer. Limit your portion sizes. As people's activity changes and as we get older, we need less food. But sometimes our idea of what a plate of food is or what a meal is doesn't. And we continue to eat what seemed right a few years ago. So having a look at what's on your plate. And then filling up on fruits and vegetables. Fruits and vegetables are full of vitamins and minerals and not so full of calories, but they make us feel full and do all kinds of good things for us. In my experience, it's a lot easier to avoid weight gain than it is to lose weight, especially when you have MS. When your activity level is limited by your disability, and when you're getting older, we just need fewer and fewer calories. And to lose weight, it becomes extremely challenging. Oftentimes, my patients will reassess their goal as being to avoid further weight gain rather than to lose weight, because at a certain point, you have to restrict your calories to such an extent that you're not able to eat healthy anymore. So I'm really trying to encourage patients in the clinic to do what they can to avoid weight gain, because having seen it from both ends, it's a lot easier to avoid it than it is to get the weight off. Now the opposite, and I can literally go from one room where I'm talking to someone about losing weight to the next room where somebody's underweight. Underweight with my MS patients is often attributed to fatigue. People will say, I'm too tired, and I just can't bring myself to figure out what to have, make it, or eat it. Depression can certainly affect appetite. Swallowing difficulties. That's something that I do a lot of work with at the rehab center. Patients will start avoiding what's difficult for them to swallow, and that will often result in a weight loss. And access to food. It's as simple as it sounds. People will say, I can't get groceries, I can't cook, I can't reach it, I can't make it happen. So those are all reasons why we see people losing weight. So my favorite class is helping people gain weight. That's something that it's like the opposite of what you learn when you go to school to be a dietitian. You get to, instead of saying this is something you don't want to eat, you get to say this is what you get to eat. And usually my mouth starts to water. And we want people to power pack their food by adding sauces or things like dry skim milk powder. If you're having trouble eating or your appetite's poor or you're having trouble swallowing, make sure every bite you take is worth your while. So if you're having yogurt and that's all you're going to have, let's put some skim milk powder in it. It increases the calories and the protein, and you don't have to take one more bite to get all those extra calories in. You people get to choose the high-fat or regular products. You get to have the high-fat yogurts and things that the people in the room next to you were just told not to have. We encourage you as well to eat frequently. Often appetite limits the amount you can eat, so instead of eating 3 real small meals, try eating 6 real small meals. Consider a high-calorie, high-protein supplemental beverage, something like the Ensure or Boost, has a place for some people. I hate to see it replacing food, but if you're too tired to get dinner and you're home alone, it's sure better than nothing. Okay, it gives you the calories, it gives you the nutrients, it helps to keep your energy up and keep you from getting tired because you're not eating. And finally, you want to adjust the texture of foods to make them easier to chew and swallow if that's the reason why you're not eating. If you're not eating because it's hard to swallow, there's all kinds of suggestions that we have to offer. Nutrition can help you take care of your bowels. A lot of people with MS have problems with constipation, and nutrition has a significant impact on how our bowels work. High fiber whole grain products absorb fluid in our bowel and allow it to swell so that things start to move through your bowel, and you end up being less constipated because things are moving better. The only way the whole grain breads and cereals are going to be of any use to you, though, is if you're able to drink enough water to make them work. If you don't believe me, go home and take your cereal, your All Bran or your Bran Flakes or whatever high fiber cereal you have in your cupboard, and pour some water on it and just watch it. In 10 to 15 minutes, you're going to have a big, soft pile of moist cereal. That's what you want going through your gut. You don't want that dry All Bran. Many people limit their fluid intake. A lot of patients with MS have problems with needing to go to the washroom frequently. And the way they manage that is by cutting back on their fluid intake. Fair enough. If you're going to cut back on your fluid intake, don't increase your fiber intake through the whole grains and the breads and cereals. What you need to do is concentrate on fruits and vegetables. They need less water to be effective, and they can help you out as well. I always encourage my patients to have at least 3 servings of fresh fruit. When you think about fresh fruit, you can see the fiber. You look at grapes and blueberries and a pear and an apple. You can see the fiber. The fiber is the part of food that we don't easily break down and absorb. That's what makes bulk and what makes movement through your gut. Fluid intake is tricky. The larger we are, the more we need. A 200-pound individual needs more than 3 liters a day to make everything work right. A 135-pound person needs just over 2 liters. A lot of people struggle with getting the right amount of fluid, and if that's the case, you really want to take a look at your fiber intake. Make sure you're not getting yourself into more trouble. Bladder is the next thing where nutrition plays a role. A lot of times we hear about increased occurrence of bladder infections for people with MS, and that can be because people aren't able to empty their bladder completely, and urgency tends to lead people to reduce their fluid intake. So you end up with a more concentrated urine in your bladder, which is more inviting to bugs and bacteria. My tips are to drink water as often as you can, even if it's small sips throughout the day. Spread it throughout the day. You can't make up for it all at the end of the day. If you realize at 5 o'clock that you've been running around and haven't had anything to drink, you can't drink it all then. You have to spread it throughout the day. And if you're having problems with getting up at night, that's always a fall risk, and it affects your sleep quality and your fatigue. So the goal is that you're not getting up to pee at night. So we recommend that at about 8 o'clock you start limiting your fluid intake, and hopefully that'll help. Oftentimes people have to find their own way. People's bladders do their own thing. But keeping these tips in mind, really cutting back on the caffeine as well, can help you avoid the urgency and get a good night's sleep. Bone health is something that's really important to all of us. We see the fall risk is greater for folks with MS, so we've become really diligent early on in our meetings with people to talk to them about the importance of keeping their bones strong. And we need to start as young as we can building strong bones. We need vitamin D and calcium to make bones strong. Vitamin D, the actual requirement right now is officially 600 international units. Dr. Short and I never recommend less than 1,000. And we want that 1,000 international units to be a supplement on top of what milk you drink and what margarine you use and what sunshine you get. So we're pushing for 1,000. Some folks are choosing 2. The literature is suggesting that you don't want to do more than 4,000. It's something that's really changing. The recommendations have changed numerous times in the past few years. Not long ago, we were saying take as much as you want. It looks like it's helping all kinds of things, but then we were reminded that it's a fat-soluble vitamin. It does build up, and you possibly can take too much. So right now, we want everybody taking at least 1,000. It's really hard to get it from your diet. You get some from milk. Not a lot of us drink 10 glasses of milk a day, and I don't want you to use that much margarine. So it's hard to find vitamin D. We can't count on the sunshine here in Nova Scotia, so we want you to take that supplement. The calcium, that's changing as well. The calcium requirement is 1,000 to 1,200, and we want you ideally to get that from milk or from food. We used to recommend supplements all the time, and what we've learned through research is that supplements are more likely to result in some buildup in your blood vessels, which can be related to some cardiovascular concerns. So we're now going back and saying, let's look at your diet. How much calcium can you get from your diet? It's not nearly as hard as the vitamin D. Milk is great, yogurt is great. You'll see I've written plus, and that's because different products contain different amounts of calcium. So read your labels, have a look at things. It's amazing how well you can do with diet, as long as your diet includes dairy. If not, the fortified soy beverage and the calcium-enriched orange juice are good options. What Dr. Short and I recommend is if you can't get everything you need from your diet, add it up and only supplement to equal 12 or 1,500 max. So don't discount the 500 or 600 milligrams of calcium that you're getting in diet. Your supplement then would only be 600 on top of that. Skin integrity is something that we are interested in clinic. Anytime that your circulation is affected by something like sitting in a wheelchair or a brace, you can affect the flow of nutrition and oxygen to that area. So nutrition becomes extra important to keep skin healthy and help it avoid, keeping it strong to avoid the chance of tears or breakdown. Or if someone does have skin breakdown, then their nutrition needs just go through the roof. We encourage people who aren't sure they're always getting what they need through their diet to take a multivitamin. And if we're worried about someone's skin, we want to review their protein intake with them and make sure they're getting enough. Rule of thumb, if you're interested in counting your protein, is we recommend 1 gram per kilogram of weight. It's a little less than that if you're not at risk of skin breakdown, but if you are, we bring it up to 1 gram per kilogram of weight. I'm going really fast. There are all kinds of alternative options related to diet that are found in the literature, and I've been hearing about them for 23 years. When I started, the swank diet was something that was really interesting. There's lots of talk about polyunsaturated fatty acid supplements, a gluten-free diet, an allergen-free diet, the McDougall diet, and the newest one that I'm aware of is the Mind Your Mitochondria diet, the Terry Wall protocol. And these are all really interesting. Different amounts of research have been done on them. And what we ask people to do when they're exploring these alternative options is to look at what research went into these recommendations. In order for healthcare professionals to recommend something, it has to be studied and proven, and the trials have to be blind. The person doesn't know what to expect. The clinician doesn't know what protocol they're following. It needs to be, like Dr. Fisk was mentioning, it needs to be something that's repeatable. You can do the same study in BC or in Nova Scotia and find similar results. We need to be really sure before I can stand here and tell you that's what you should do. A lot of the alternative information that's available right now is testimony. It's somebody who tried something and it worked well for them. And I think that's great, and I would love to be able to tell you that I think that the the Terry Wall protocol is going to be the answer. It certainly seems to have been the answer for her. We can't come out and say that. Her diet, I'm sure most of you are familiar with it. It's very, very high in vegetables, berries, and things that you hunt or gather. So lots of meat, seaweed, a lot of things that she's hoping will help to rebuild her mitochondria. What worries me about it is it has no dairy. So unless you're taking calcium and vitamin D supplements, I'm worried about her bones down the road. So those are all things that I encourage you to explore and think about, but try to remember the Canada's Food Guide and the things that are specific and helpful to you as somebody with MS, and do your best to marry both. So this is just my, please have a look at how that research was conducted. I was on the website today looking at the Mind Your Mitochondria diet, and she's talking about doing clinical trials, but I couldn't find them. Now perhaps somebody else has, but that's what we need to see, clinical trials where people don't expect to feel better, because we all know the placebo effect. If I'm given a medication and said, you know, you're going to feel great tomorrow, you're not going to be hungry, chances are I'm going to feel great tomorrow and not be hungry. The power of suggestion is a strong one. So in summary, there really is a role for diet in managing your symptoms. Healthy eating can help you manage and feel better every day. There at this point is not a diet that will cure MS, but there sure is a lot of nutrition that will help. And thank you very much for your attention.